Welcome to DBC Diaries, episode 38. I'm Josh, here with Dream Body Clinic, and today you're going to see returning patient Filippo. He came all the way from northern Italy. Again, he was here last year. And last time we did his knees, we did his lower back, we did the intrathecal, and also that comes with the IV. And he's feeling amazing. We also treated his wife, and this time he even brought his parents. He's very happy with the treatment. It's been great, and we've helped him a lot. He's had a lot of surgeries in the past, so his back was in pretty bad shape, but we've managed to get him some really great progress. So our back treatment is a bit different than some of the others out there. There's a few different approaches that you can take. So we found that going around the discs that are most affected has been the most effective way for us to help it. Some clinics will actually go into the disc, and that's very invasive. We did it in the past, actually. There was about a year and a half there where we were treating patients this way, and we'd have to go into the operating room. You have to go under sedation for the patient, or twilight sedation, because they're on their stomach. They can't be fully asleep. So it's a fentanyl drip. Pretty intense stuff. And then go into the disc. But the problem with doing that, we found after comparing before and after results, was that we actually get better results going around the disc, because in the disc, the stem cells have nothing to work with, because this type of stem cell, a mesenchymal stem cell, Dr. Arnold Kaplan, who named them, wishes he could have renamed them medicinal signaling cells. And that's because they work via the signals they send out. This is called the paracrine effect. So if they're in the disc, they don't really have a way to communicate outside of the disc. They're not going to turn into new disc tissue or cells. So we typically would see some improvement, but it was more the around injections that we did after that were getting the better benefit. So by going around, like what we did with Filippo here, the cells are working from the outside in. They're like the manager on the construction site, guiding the repair process, helping guide the removal of scar tissue, and most importantly, helping to guide the rehydration of herniated discs at night. And this is why it works so well for Filippo, as you'll see here, he'll explain it a bit later, and why it works for so many other patients. So that's where we're at with the back treatment. For the knees, real simple treatment, go into the knees, cells can target and go from there. Help guide the removal of scar tissue, then help regenerate tissues like meniscus, cartilage, ligaments, tendons. And for Filippo, it worked great. He didn't have to do his knees again this time because he was feeling so good. And so stay tuned. See what it's like to be a patient here at Dream Body Clinic. You'll see the interview with me and Filippo a little bit further on, where he'll explain how things have been and going for him. And we'll go from there. Today, Filippo arrives. Our drivers are going to pick him and his family up at the airport. They're going to come through baggage claim. They're going to come outside of the airport, turn left, and they're going to see a bunch of people holding signs, and our driver is one of them. Meet them there, go to the car, and we'll get them to their hotel. We have 8 drivers on staff. Every one of them has a brand new Ford Expedition. So we've got plenty of room for patients. Even if you come in a group, we can get you to your hotel or accommodations where you can then rest and relax, which they're going to want to do. They came all the way from Italy. It's a long flight.
During these 5 days, DBC will offer free transportation to Filippo and his family.
So today, the blood sample we use for the blood test. And the day of treatment, we will take another blood sample to obtain the plasma.
DBC Diaries Day 2. Today, Filippo and his family are coming in. We pick them up in the morning at their hotel, bring them to the clinic, where we start with analysis. We're going to check blood pressure. We're going to check height and weight, take a blood sample so we can send it off to the lab for analysis that we'll be able to review the next day. For Filippo, he also had to do an MRI, and so did his mom, so they came in and did that also. We have an open MRI. It makes it more comfortable, less claustrophobic, but it's an MRI. They're never that much fun, but easy to do here as we have it all on site. And we do require an MRI for all joint treatments. We're no longer accepting MRIs from abroad, we'll review them. We're happy to do that for free, let you know if you're a good candidate. But we've gotten too many just bad reports from abroad that were inaccurate, didn't give good info, or incomplete, that our doctors now require all MRIs to be done here on site with us. So we do that. And then when they're done, we get them back to their hotel so they can enjoy the day. Usually patients are here on that day for anywhere from half an hour to like an hour or two, depending on how many MRIs that they have.
Today we have the consultation with Filippo and his family. So in this time, so we can see the difference between the old MRI and the new one. And I'm going to do the same thing with everybody here. We are going to check the blood work. We need to do some questions about the medical history. This is part of the protocol. So we normally do the first day like consultation and then the next day the treatment. So if the patients have some questions, day after the consultation, we can resolve that.
DBC Diaries, day 3. So today is for analysis. Today, Filippo and his family are all going to come in. They're going to meet with the doctor. They're going to review the MRIs, review the blood work, go over them line by line, image by image, so they know exactly what's going on. This helps us just make sure that these are things that we can fix. It's rare, but sometimes we'll find like a ton of osteophytes, which are bone spurs in your bone growth, and it might not be appropriate to do treatment. It's rare, but it does happen, and we'd rather know and let the patient know than to continue with treatment if we're not going to see results. So very careful with that, very thorough. And this is the day we go over it all to make sure it's good. Then we head upstairs, meet with our admin team, take care of payment, and then you go back to your hotel and hang out on the beach or rest or whatever you want to do. DBC Diaries, day 4. Today's treatment day. So Filippo and his family are coming in. They're going to just briefly meet with the doctor, make sure there's no last minute questions, and then we get at it. So we usually start with the joint treatments, like in his case with the lower back, then the intrathecal treatment, which is where we go into the spinal cord fluid, allows the cells to go up the spinal cord, get to the brain, and start healing there, and heal any damage in the spinal cord. Really good for memory, really good for just regular cognition, improved cognition, function, brain optimization. So we do all this, and then we get to the IVs, if those are in the treatment like they were today. So now stay tuned. You can see Filippo, his testimonial of how treatment has been going for him and why he's back again here at Dream Body Clinic. Hi, this is Josh, Dream Body Clinic. Welcome to DBC Diaries episode 38. I'm here today with returning patient Filippo. How are you doing?
I'm doing good, Josh. Very good to be here.
Great. And this is your second time here. Last time you came all the way from northern Italy, right?
Yes.
It's a long ways to come.
It's a very long trip. Yeah, I tell you, man.
But it sounds like results, you saw results from treatment. You're feeling good. Like, what all did we do last time? I think it was knees, back?
It was knees mostly. So the most important trouble and problem that I had, why I looked for this kind of treatment, was my back. So I had surgery last January 24. Okay. And I do contact your clinic and I do decide to choose for your clinic, to be really honest, for your honest approach. Because at that time, before surgery, so I send you images and you check it with the doctor, and the doctor claimed, look, we can't help. And it was a really, really honest approach to me.
Nice.
So it sounds like a really honest approach. And it's something that I do also do my research and contacted many clinics all over the world. And most of them, they claim, look, come, we can help. So, and I do decide to come after surgery. So because I definitely decided with a surgeon that in my case, it was needed.
Yeah.
for better recovery after the surgery. So you claim now we can help in some regeneration, get rid of inflammation and all the scar tissue that I've got. Also for the surgery as well. So this was the main reason that I decided.
Got it. Yeah, as we were looking at the images, and was it L4, L5, or which disc was it that was herniated?
It was L4, L5, L5S1.
Got it.
Okay, but there was also spondylosis. Spondylosis. And basically, the surgery was about for spinal stabilization. So they do perform dynamic stabilization instead of a fusion.
Oh, okay.
So it's a similar technique. So basically, there are a screw and a rod connecting the screw, but this kind of rod is kind of flexible. Okay.
Okay.
So it didn't fix your back. So it's factor. So the mobility is still, it allows the mobility while stabilizing the spine. Okay.
Good.
Probably longer recovery in that kind of, but maybe better outcome.
Got it.
In the end.
Yeah, and then we saw you did have originally when you came a bit herniated disc, and so we did treatment. They're still herniated, but we noticed less herniation and ton of inflammation reduction because that was a big one before, and you were in a lot of pain before, and I think you were saying you feel a lot better now, right?
Yeah, from 1 to 10, I tell you. So in the worst days, I'm maybe at 1. Okay, right now. While when I came here, I was recovering, not in the worst condition, because as you say, it's a long trip. So if you are at 10 in pain, so you can even think about it. And I was at 5, 6, but now I didn't even call a pain. It's the kind of discomfort in my sciatica. Okay,
that's awesome.
Kind of discomfort. So the quality of life, definitely improve.
Oh, that's excellent.
Consistently. So
good. And how are your knees feeling?
Oh, the knees are good. So they are cracking anymore, but not hurting. Okay. So I saw a little bit of improvement. Let's say. Okay. Yeah.
No pain, no problem. I mean, that's cool, right?
Yeah. Of course.
Cool. And then we did the intrathecal. So gets up to the brain. Did you notice any changes brain-wise, like dreams, memory? How are you feeling?
Look, maybe. So I think it's most difficult to notice instead of physical condition.
Yeah, it's anecdotal.
But I think I'm more relaxed. I'm more stress-free. Okay. So I can manage stress that everybody has. Working. So for your job, for life, for whatever. So. That's a kind of improvement that I saw.
Excellent.
We are taking intrathecal for trying to improve also the nerve damage that I had. Because I tell you, so maybe I don't think you do remember, this last is my 3rd back surgery. Jeez. So it's a kind of degeneration. So unfortunately, I've taken this decision back in times, and I was too young to have a surgery.
Yeah.
Because Well, now I know it's a kind of destructive approach. Yeah. They fix something, but to fix something they do remove stuff, generating instability.
Yeah.
And
I think that's a big thing people don't realize, that my mom had a fusion on her back for these polyps that kept forming. And, we were able to get her pain-free with just the IV, but it's been 5 or 6 years. And now, where she has the fusion, I think it was like L4, L5, is now the discs above it were starting to herniate because they were taking all the pressure. And so she had to do the back treatment to fix that. And it's, you fix one problem, but sometimes that can lead to other problems. And the cool part with the stem cells is it's not very invasive. It's really fixing tissue, rehydrating discs, and trying to get people back there. So that's the goal with us.
And the earlier the better, I guess. Yeah. If you take earlier.
3 surgeries, man.
I decided to bring my mom as well and my dad.
Yeah, no,
my mom is in a even worse condition than me. So maybe you can help a little bit. So stem cell can help a little bit.
Yeah. We're gonna help out your mom today. That's the goal. And your wife came this time too. So
Yeah.
and you brought the whole family. That's awesome.
My wife performed her neck last time.
Oh,
so
that's right.
she almost immediately feel better.
Really?
And she never had any trouble in her neck.
Oh,
So
that's awesome.
that's why, so probably in a better condition, so not very bad. So the efficacy of the stem cell are very good. So
Yeah.
and there's no need for a new treatment. So instead, she's taking only the facial. Yeah,
Good.
why not?
Yeah, well, and
Since you're there.
I think that's great for people to realize. I mean, like, look, sometimes there's a lot of damage. Filippo's case, it might take more than one treatment. But like you said, I mean, you went from like a 5 or a 6 down to a 1. I mean, you didn't need to do treatment again if you didn't want to, but you just want to keep the progression going because you know what you have might keep going. But then for his wife, we did her neck and 1 and done. You know, she doesn't need to do her neck again. That's awesome. We're just, you know, just the vanity treatments, get the face looking good, which I do probably twice a year. I love that treatment. So it's really good for the skin tone, build back the collagen. Now, it's not like Botox. You're not instantly wrinkle free, but it's more natural, it's like slowing down the aging process. The facial treatment's awesome for that. Yeah. Well, man, thanks so much for coming back. You know, thanks
My
for
pleasure.
sharing with people at home. You know, we're always telling people we get people from all over the world. And, you know, Filippo's a great example of that. Came all the way from Italy. So thank you so much. And if you'd like to learn more about stem cell therapies and what we do here at Dream Body Clinic, get a hold of us. You can go to the website at www.dreambody.clinic, or you can call us toll free at 888-704-3977. I'm Josh. Happy to help. DBC Diaries, Day 5. So today, that's it. The Filippo and his family are done. We're going to be able to get them from their hotel, take them to the airport so they can catch their flight back home to Northern Italy. So we want to thank him and his family again for coming, sharing their experience. And if you at home would like to learn more about stem cell therapies and what we do here at Dream Body Clinic, please get a hold of us. All the information is at the website, www.dreambody.clinic. Scroll down on the homepage, you'll see all the treatments listed there. You can click on the links, information, prices, everything's listed so you can have all the information, and you can also call us. We do free consultations. If you have recent MRIs, scans, or just questions, call us toll free at 888-704-3977. I'm Josh. Happy to help.